Can I have my slides, please? Yeah, I will be talking to you, all of you, on novel method to screen patients for glaucoma by translead tonometry. This is basically a community-based project. This was developed in collaboration with the Vishweshwaraya National Institute of Technology. So I acknowledge all the engineers there. As you know, approximately 11.2 million persons aged 40 years and above have glaucoma in India. Many people go blind undetected. Therefore, there is a necessity to screen patients for glaucoma at large. In the light of existing manpower and resource constraints, we evaluate options for screening glaucoma. The only modifiable risk factor for glaucoma is intraocular pressure. There are various methods which are available for the measurement of the IOP, and the applanation tonometry by handheld or by slit lamp mounted is the basic one and the most appropriate one and gold standard. So the drawback of the applanation tonometry is you need to indent the cornea, the cost which is involved, and the physician need for the measurement of the intraocular pressure. So we have developed this device without compromising on the quality. The working principle of this method is the invert Fick principle. When you apply pressure on the sphere, the volume inside the sphere is equivalent to the pressure which is applied and the surface area. The same principle being used. This was the experimental device which was developed. It has a cylinder with plunger and a pressure sensor. The plunger has a circular plate of approximately 3.06 mm. The tip of the plunger was placed over the closed lid. This is the experiment which we perform. It has a cylinder, and you can see it is pressed over the closed lid, and the cylinder has a sensor which was carrying the signal to the indicator either in the form of red or green. It was adjusted to 20 mm of Hg. If the pressure was more than 20 mm, it was red, and if it is less than 20, it was green. So the initial device which was developed was cumbersome and with lot of wires, but it was detecting the intraocular pressure either less than 20 or more than 20. So there was lack of digital reading. So we developed the finite element model, and the 3D analysis of the same thing was done. So, but there was a problem of lid pressure. When we indent the lid, there is always a problem of lid indentation. So that was also taken into consideration. When we indent the lid, the pressure which is exerted by the lid is around 4.1 mm, which was adjusted to the sensor. So the device was modified to this one, which was giving the digital reading also, and the changed sensor, which was high sensitive pressure transducer, was introduced. The testing of the device was done at the tertiary eye care center with ethical approval from the hospital. A single observer which was proficient in taking intraocular pressure by applanation was considered, and he measured with applanation method as well as with the new device. The initial reading was with the new device after interval of 15 millimeter. After interval of 15 minutes, IOP with applanation was taken, and three readings were taken, and the mean of three reading was considered. Assignment was consecutive, and the patients coming to the OPD. Exclusion criteria were patients with corneal opacity, operated case of glaucoma, lid abnormalities. Those who underwent refractive surgeries were excluded. Data was compiled and filled into the Excel sheet. So this was the area which was needed to be indented. When we close the lid, there is elevation which is there, and this area need to be indented. And this was with the device. The device had a plunger which was of 3 mm size, and the area of the plunger was 3.06 mm. So it was giving the digital reading also. The cleaning of the device you can do with the sodium hypochlorite or with the saline also. The statistical methods which were applied were Mann-Whitney test, regression analysis between two groups, Pearson's correlation, and the sensitivity and the specificity of the device was also um, done. The total eyes which were screened were 956. This shows the mean age, number of males and females, and with applanation method, it was 14.18 mm. The range was 7 to 48 mm, and with the new device, it was 10 to 15 10 range was 10 to 58 15.8 mm of mercury, so there was not much of difference. This was the coefficient of correlation between the two devices. It was almost correlating, and the sensitivity of the device was 90%, shows that it is able to detect positive glaucoma subject 90% accurately, and the specificity of the device was 88%. The advantage of the device is portable, simple for health workers in rural areas, a simple method to measure IOP, no need of ophthalmologist. If patient wants to measure IOP at home, but he need to teach about the things, the screening of the patient in camps and rural areas, and no need of local anesthesia and fluorescence. The limitation of the device is we are in process of fitting camera on the plunger, so that we will come to know the exact position of where it is indented, and multi-center studies which are required. So the conclusion of my study is that detailed statistical analysis showed no significant difference between the IOP measured by the application and the tonometer. And it is excellent device, zero contact with cornea or influence of corneal biomechanics on IOP results, provides best way for rapid screening of this patient in the community settings. Thank you.
Dr. Rajesh, are you aware that such a device is available commercially in the market?
Uh, in fact, there is a transscleral device which is available. We need to place it over the superior aspect of the limbus, and that measures the intraocular
If you
pressure.
get a chance, visit the Mediscience Devices stall. I think they have one which measures over
Yeah,
there.
it is a transscleral.
So have you ever tried remote thermometer?
No, sir. Yeah.
Because remote thermometer is a very simple device and it's we are using for last so many years. It is comparable with imaging, the readings are comparable with application. And it's there's no need to recognize the eye, and even we can use it with the child also. So let's see this content also, there's so many stalls.
Yes, sir.
Having this remote thermometer, it's not very costly.
Yeah. The duration needed is very short, and it will come in market shortly. Yeah, for home care. Yeah. Yeah. Thank you.